Good morning and welcome to the first ever Rabito Cosmetic Centre virtual event right here on social media, and I'm so excited to be a part of this conversation because this is a topic that I discussed not too long ago, and I had so many young women coming forward and asking, how do I treat acne? I mean, I try to cover it up with a lot of makeup, but then it still pops out in my makeup, and so I don't feel confident. I need some help. Well, Rabito Cosmetic Centre says the help is coming in today, and so we're going to be talking about that. But even before we get into the conversation about acne, first of all, we want to take a look at what, process you have to go through to get ready for a day out with your girls. If you're going for a wedding, you're going for some event, and you're trying to get your skin prepped for that event. So it's humid in Ghana as well, so sometimes you need to get the right kind of makeup. You need to get your skin on point so you look the part all through the day. So we'll get into that conversation shortly, and then right after that we'll speak to Dr. Frank Appiagyei, and he's the resident doctor here at Rabito Cosmetic Centre. He'll tell us what kind of treatment you require if you're suffering from acne, or maybe you've treated acne but then it's left some dark spots. I know there are some of you who also have these tiny holes on your face, and you're looking for a solution to that because you're still not confident enough to walk out without heavy makeup. We'll talk about all of that. And so join us, of course. I know you're watching us right here on Facebook and also on Instagram as well. We are live. But let me just give you the handle so you can share it to your friends. So on Facebook, you can find us at Rabito Cosmetic Centre. Just share it and let everyone else join in the conversation. Instagram as well at Rabito Cosmetic. So no center for the Instagram handle, just Rabito Cosmetic. And by the way, the center is located here in East Legon. So it's at 2627 Paw Street behind Malcolm, East Legon, Ghana. And Malcolm is a very central point for many people who like to come to East Legon. So just right behind it, if you ask anybody that you're going to Rabito Cosmetic Centre, they'll point you straight to it, and it's not too far. But let's get into our conversation now. Before I speak to my doctor, I have a beautiful model here who's prepping. I'm not sure where exactly she's going, but I can tell you that she's beautiful, and she's even going to look more stunning by the time this makeup session is over. And also I have her makeup artist who is also a professional. I'll let them introduce themselves and then we'll get into the conversation. Hello ladies, good morning.
Good morning, Bella.
Good to have you on our first virtual event. Can you introduce yourselves for everyone else who's watching?
My name is Sandra.
And I am Naa White Face Talks on Instagram.
Naa White Face Talks on Instagram.
Yep.
That's the handle. So she's a professional makeup artist, and if you want to check out her work, just go on Instagram, Face Talks GH.
Yep.
Face Talks GH. But where are you going? I mean, I see you prepping.
For a friend's wedding.
Oh, a friend's wedding. Vanessa, is that like a best friend or something? I like how you said Vanessa's wedding. I'm sure you've been preparing for this.
Yes, I'll just change.
Yeah? Okay. Well, we'll get into that conversation shortly, but I'm waiting for a number of you to join us so that you can also send in your questions, your comments, whatever it is that you want to ask our doctor, our makeup artist, whatever it is, just let us know. How do you prep your face even before you get ready to step out with your friends? We're waiting for a number of you to join us, but remember that we are on Facebook at Rabito Cosmetic Centre and also on Instagram at Rabito Cosmetic. Just send us your message, send us your questions, and let's talk. We're talking today about acne. If you just joined us, my name is Berla Mundi, and I will be your host for today. But I'm not the one giving out all the information that you require. I mean, we have professionals, and these are people who have been doing this work for many, many years. They understand what it means to take care of your skin. And for a woman, I mean, your best foundation is your skin, your natural skin. If you have it on point, you don't have any problem at all when you have to apply some foundation, some powder, eyeliner here and there, just so you can step out. And there's nothing better than being out there for many hours and still feeling very confident because you don't have to battle with acne under that pile of makeup. And that's what we're talking about today. So I'm glad to have you all join us this morning. It's our first ever virtual event on social media. And send your questions, send your comments, whatever it is. There's a little I've read about acne and the fact that there are various reasons why certain people may get acne on their skin. So sometimes it's genetic, sometimes it's probably even the food you eat, your lifestyle, a number of things. So I'm sure you're thinking, what could be the reason why my skin isn't as clear and smooth as I would want it? Could it be that I'm doing something I shouldn't be doing? Am I eating something I shouldn't be eating? I hear even stress can cause acne. Yeah. So if you're not getting enough rest, if you're always working, always running around and not giving your skin time to breathe and relax, that could be a reason. But Dr. Frank Appiagyei will get to us on that. But let me go straight to my model and resident makeup artist as well, so they can tell us. Earlier we're talking to Sandra, that's your name, and Sandra is a beautiful model for today. And also Naa White is the CEO of Face Talks GH, and you know makeup is a very essential part of our everyday life now, because everywhere you go you still need to look the part. So Naa White is here, and again follow her at Face Talks GH. You mentioned earlier that you were going for a friend's wedding, your best friend's wedding. So what kind of look are you looking at?
Subtle glam, but
Okay.
with a bit of shimmer.
Subtle glam. I'm wondering what that is when we say subtle glam.
So what goes into that is
Yeah.
you use a lot of neutral tones.
Okay.
But you make sure that at the end of the day, the person is looking properly highlighted and looking flashy.
Oh,
Let's
okay.
see, but in a very subtle way. I call
see.
it the ladies' makeup.
The ladies' makeup. I see. So wait, what I have on is what? Subtle glam or?
Yes.
Oh, it is?
Yes.
Guess who did it? Me.
Oh, are you kidding me? That's good.
Thank you very much. And maybe I'll learn a few tips from you as
good.
well. I mean, I steal a few tips from you sometimes, you makeup artists, based on what you do for us on our faces. But you're all doing a great job, I must say. And thank you for making us feel confident and look beautiful, you know, even with our beautiful skin. And so please send your questions, send your comments. If you have any opinion, if you're also a professional, you want to chip in some advice, you can do so. There are a lot of us who are watching on Facebook and also on Instagram, and it'll be nice if you can share your tips with us so we can also learn from you. But usually, how do you go about this process? I mean, what should you start with if, you know, I want to get this kind of look and I'm going out?
Okay, so what you start with is to have a knowledge of the person's skin. I mean, that should take you about 2-3 minutes if you're a professional.
Okay.
You should know what skin type you're working on once the person sits in front of you,
Oh, I see.
so that you know what products to use.
So
Mind you,
what skin type, not to cut you, but what skin type are we
she's
working
got
on?
an acne-prone skin. She tells me she's worked on it, so
Oh,
it's
you
all
have.
looking clear now.
I see.
So you should be very careful or mindful of the products
That
you
you
put
use.
on her face. That is key.
Why is
That is
key?
very key, because one, you don't want the client going back home and not being able to take off all the makeup completely, so the pores are not breathing, and in the end she'll end up breaking out again and coming back, now having to also go through the whole process of clearing her acne again. You don't want that happening.
How
So
bad?
products,
Yeah,
it's very
it's very important. How bad was it in the past?
It was all over my face. Yeah.
Really? And you had to come to Rabito for a solution. How long did it take for you to have your skin clear?
Close to a year.
Close to a year. Before that, how did you feel about your skin?
I didn't like my skin
At all?
Yeah.
Why?
Because I always had to wear makeup.
Oh, so now you can actually step up. So have you done any makeup on her skin apart from her eyes?
No, apart from her eyes.
So this is
nothing.
her skin?
This is her skin.
And you couldn't even
Thanks
walk
to
out in the
Rabito.
past? It must have been serious. So thanks to Rabito, exactly. And Dr. Frank Appiagyei is here. So maybe he can tell us a bit about Sandra's history and what she had to go through in order to get her skin clear to this point. And if you're watching and you're worried, maybe you should use Sandra as your inspiration, because if you also come to Rabito Cosmetic Centre, you can have that confidence to step out. Good morning, Doc. Thank you so much for joining me. Again, I mean, I've spoken to you before about other skin conditions, but today we're talking about acne. She says that she was not confident in the past to even walk out. How bad was it?
In her case, it was really, really bad.
Okay.
And the diagnosis initially we had was nodulocystic acne.
Nognosistic.
This is a scientific term. So
Okay.
basically what it
That's
means
our
is
level.
that, yes, that's exactly what I'm going to do.
Yeah.
So what it means by that is you have this big cystic. When you say something is cystic, you have fluid inside. So it's underneath the skin, is huge on the face. Not the typical black heads or white heads that we tend to see on the face.
Okay.
This one goes beyond that. This is a severe acne, and they usually don't do well with the normal treatment. So mostly people tend out to use these topical creams. Topical mean anything you apply in your face.
Okay.
And it doesn't work because this type of acne is a bit different, and it management is also different, and you have to treat it aggressively because of the aftermath of the scars that you tend to get sometimes when you don't treat it early. So early treatment is key.
Early treatment. So,
yes.
Would you say this is the biggest misconception about acne? That people think that every acne is the same, and so they treat it the same way?
Yes.
Okay.
Yes. It's not the same because we have different types of acne.
What are the types? If
So
you can just go into that.
So we have different classifications. We have one that we have the white heads and the black heads.
Okay.
We have the nodulocystic acne.
When you say white heads, by the way, so what you have white substance
Yes,
sticking out of?
exactly. And you have
Okay.
the black ones. The
I see.
those are the what we call. And another thing, there's another misconception where they think pimples is the same as acne. They are
it's
two
not?
different things. No, they are not. So
I actually thought it was the same.
no, it's not. So the pimples is a symptom of the acne. So the acne is the diagnosis. So you have acne, then you have pimples, white heads and black heads. So the
Okay.
two are the pimples. So once you get that one out, you know that you are dealing with
You're
an
good.
acne.
I
So
see.
because you have other similar conditions where they don't have the black heads and the white heads, so you can't classify them as acne. Do you get what I mean?
I get what
Yes.
you mean. But what causes it?
The cause is multifactorial. You cannot really have one cause actually like be the main thing.
Yeah.